Hey friends out there in internet land, my name is Dr. Zach Ward. I am a structural upper cervical chiropractor. I practice in Auburn Hills, Michigan. I am making a series of videos called Alignment Matters, where we look at some x-rays, we look at some posture photos, we get to see how the spine can shift and how that impacts health. I do like to make videos with some very dynamic shifts in the spine and in the posture, but this is not one of those videos. And the reason is intentional, and that is because we're going to talk about arthritis and degeneration. Arthritis and degeneration are two words that patients will come in with that they've picked up from maybe another doctor or provider, and they wonder, is this something that's going to affect me forever? Is it something that can change? So we're going to talk about that using a real case of a woman in her late 60s who would have a lot of quote-unquote arthritis or degeneration in her spine as a diagnosis. So let's go ahead and jump on in. A few ideas that you need to think about with me that kind of explains the thinking or the thought process behind how we work. The first idea is that the spine has an ideal shape. The second idea is that the spine is made of movable joints. That includes the muscles, bones, ligaments, and the little discs between those bones. Altogether, those are called joints. And how these joints interact with each other, that creates the shape of the spine. And these joints affect the spinal cord, the spinal nerves, and the fluids of the spine, which are found inside and traveling through that area. So we'll talk about a case of a woman in her late 60s with neck pain, low back pain, and sciatica, and we're going to look at her neck x-ray specifically. And so if you've never looked at a neck x-ray like this before, it may be a little bit confusing, so let's go ahead and orient you. So this is the back of her skull. If you were to kind of place your hands on the back of her head, it would be right here. This is going to be the angle on her jaw. Her teeth are over here. This is the eye, okay? And then this is the first cervical vertebrae, the second, third, fourth, fifth, sixth, and seventh bones of the neck. And below that, we have the start of the thoracic spine. The shoulder is going to be in here. So the neck is curved this way, which is nice. Some loss of curve in the neck, but she does have somewhat of a curve. She's looking that way. Okay, so there's oriented to what this looks like. We're going to look at two pictures side by side. The one on the left is the before image, and that's taken in September of 2015. And the after image is taken in July of 2016, this year. And we're going to kind of zoom in and look at some slight shifts, but shifts nonetheless in the spinal column, even though she has a lot of degeneration. So we're going to go ahead and zoom in a little bit. And so what we mean by degeneration is when we look at the space in between the joints, you're going to see there's not a lot of space here, and there's a minimal space here. It's diminished. That's the space where the disc is. There's some space here, a little bit more space there, some space between 2 and 3. And then when we look at the back, there's a lot of fuzziness on all these joints. There is some joint breakdown happening, which is actually better visualized in another x-ray. We just don't have time to see that right now. And then we're going to see some difference in underlap or overlap the back of the vertebrae. So I'm going to draw a line, and we're going to see how the back of this line kind of shifts and does this. So that break in that line, especially right here, and a little bit up in here, is an indication that there's some degeneration in that breakdown. We would call arthritis. Another area where we would look would be right here at the front of the bones. See how fuzzy that is. There's like this little bony growth, some fuzziness here, a little bit of fuzziness there. Those are all signs of breakdown and arthritis or joint inflammation. So now let's go ahead and draw the back of the vertebrae. We're going to create a shape out of this neck. And so what we're going to do is we're going to go corner to corner down 2 and 3. We're going to go corner to corner down 4 to 5. We're going to go corner to corner from 5 down to the bottom of 5 into 6, and then from 6 down into 7, all the way down into T1. So we can see how that line looks like a kind of a winding river, a little bit of a meander. It looks like a map on a road. It does not look like a smooth arc we would expect to see in a nice healthy neck, which is what that would look like. We're going to go over to the after image again, which is about 10 months later on the right. We're going to go corner to corner on 2 and 3. Okay. We're going to go corner to corner on 4 and 5. And then we're going to go corner to corner from 6 down into 7 into the first thoracic vertebrae. Okay, so the image on the right is certainly by no means perfect. You really have to know what you're looking at in order to see that there's been a difference, but there has been a difference. And that's the most important part of this, because this is a woman in her late 60s, early 70s. She has had a lot of degeneration in the neck, and there has been a shift in some of those joints. And I would look at that, let's say if I was an MD or a DO or some other provider, and say, well, there's a lot of degeneration, there's a lot of arthritis in your neck, there's not a whole lot that you can do about it. And then this person comes to me and says, well, I was told there's a lot of degeneration, there's a lot of arthritis in my neck, can anything happen? Can there be any improvement in that? I'd say, well, maybe there can be if we have a consistent quality of care over a certain time frame, and we give your body the time that it needs to do a little bit of a shifting and improvement. So again, this is not some ideal neck, and this isn't some dramatic transformation, but this isn't bad. 10 months time frame, there's been a lot of change in the musculature, there's been change in the health of the ligaments for sure, the little rubber bands that are keeping this thing together, and it's there. You can see the change. Again, not incredibly dramatic, but given the breakdown that's already there in the neck, it's great that there is change there, and that's something that people with arthritis, people that have been told they have degeneration in the spinal column and the neck, that they need to see. We'll go ahead and draw your attention to one more angle here, and that is the angle on the first cervical vertebrae. So hopefully you can kind of see how this is shifted between here and here, and if I draw that line in, you're going to see how it's got kind of an angle to it. We'll do that one more time so it doesn't look like I'm fooling you. So we're going to draw that altitude on that line, if you will, and then on this. So I'm not great at drawing these lines with the mouse, but hopefully you can see how that first cervical vertebrae is like this in the first image, and then it's like this in the second image. And it goes from pointing from about this portion of the face up to about just underneath the eye. So it's shifted up like that. That is a nice change to see in a case like this as well. So this has been a case of degeneration and arthritis in the spine that has changed over about 10 months time. Again, we weren't seeing this patient every week for 10 months. We saw them about twice a week for about a month, and then about once a week for about a month after that. And then we kind of followed up every 3 to 4 weeks over the remainder of that time frame. And this patient was looking for an improvement in the shift of her spinal column, and that's why she continued to come and visit with me, because a number of her symptoms had already pretty much diminished after that first month and a half. This is Dr. Zach Ward at Life and Alignment Chiropractic, your structural and upper cervical chiropractor in Auburn Hills, Michigan. If you'd like to ask any questions about this, please go ahead and give me a shout out via my website at laachiro.com. There's a contact box there. Otherwise, if you're local to my area, you can certainly use the number here, 598-4002, area code 248. Thanks for watching. Have a great day.